The opposition.
Mr. Speaker, to the Premier, the government can't have it both ways. The Deputy Premier routinely shouts about the 1% when we question the government's cut to physician services, but the front bench over there is the first to defend the outrageous salary of Hydro One's CEO, one that is almost 40 times that of a new doctor. Further to that, the Financial Accountability Officer report has said the government hopes that measures to reduce physician fees will help them reach their targets. They have already cut the portion of health care 3 times in the last year.
The member from Eglinton
Mr. Speaker,
is warned.
how many more times will the government slash physician
The Minister of Agriculture
fees?
is warned.
And when can doctors expect the next cut?
Premier.
So, Mr. Speaker, now we're going to talk about some of the people in the province who earn the most money, that they should earn more, Mr. Speaker. That's now where we're going. So the inconsistency that continues to come from the opposite side is quite remarkable. Mr. Speaker, what we're defending as a government in our plan is the right of the people of Ontario to have excellent institutions in their education and their healthcare system, to have the investments in infrastructure, whether it's roads, bridges, transit, water systems, that they need in order to be able to compete, Mr. Speaker, to have a government that is going to work with businesses to allow them to flourish and to become exporters, Mr. Speaker, to open doors around the world, to allow them to expand and to compete globally. That's what we're defending, Mr. Speaker. That's the plan we're implementing, and I'm sorry that the Leader of the Opposition is so inconsistent that he can't either see that or understand that we have to do all of those things.
Thank you. Supplementary.
Mr. Speaker, again to the Premier, you want to talk about consistency? A $4 million salary for a Hydro One CEO is appropriate, but a family doctor making 1/40th of the salary isn't appropriate? Give me a break. You know, Mr. Speaker, just a few weeks ago, I was visiting Windsor, and I went to the Windsor Regional Hospital. There I met just a handful of the 800,000 Ontarians without a family doctor.
The member from Trinity Spadina is warned.
From family doctors, like Dr. Jen Bondi, who just made it under the wire before your cuts to be joined by her family health team. Many of her fellow new physicians have described the medical profession as having an all-time morale and at an all-time low. They feel the Liberals have launched a systematic attack on doctors. Many are threatening to leave Ontario because of these cuts to the system.
Question.
Mr. Speaker, how can this government justify the cuts to health care? Give us a justification for these cuts.
Minister of Health and Long-Term Care.
The Minister of Health and Long-Term Care.
Mr. Speaker, there are a number of issues I think it's important for Ontarians to know that one of them is that we have increased the physician services budget. So the monies that the government, roughly 10 cents out of every dollar this government spends in the province that goes to physician services, those hard-working frontline workers, we've increased that by 1.25% last year, this year by the same amount, next year by the same amount again. And we've asked our physicians to accept that modest increase in the overall budget, and it will mean some challenges in terms of us having to make sure that we stay within that budget, but so it is so that we can provide those increases to our PSWs across the province. And so we can invest more in home and community care, as we are doing $250 million more this year. It's so we can continue to invest more money in mental health and addictions. I believe that the majority of physicians across this province support that of a sustainable health care budget and investing in other priorities.
Thank you. Final supplementary.
Mr. Speaker, again to the Premier, the only physician that supports the physician cuts is the Minister of Health. The Liberal government is gutting health care in Ontario. Governments and leadership is about making priorities. Your priorities, Premier, are $2.5 billion for the Pan Am Games, $24 million for overpaid execs at Hydro One, $3.7 million to unions without a single receipt. Why is health care not a priority? On my Windsor trip, I learned from Dr. Darren Cargill that the Windsor hospital that he works at doesn't even have a palliative care team. We have 800,000 Ontarians without a family doctor, yet this government just cut 50 residency spots. When will this government make health care a priority?
Well, Mr. Speaker, I think the Leader of the Official Opposition already knows that health care is a top priority of this government. $50 billion invested in that. We're proud of all our health care workers, more than 250,000 of them around this province. But, Mr. Speaker, it's simply not true that we're changing our investments or our commitments to doctors across the province. We put 70 separate savings opportunities in front of the OMA over the course of a year of negotiations. We did not receive a single piece of advice or reply from the OMA on a single one of them. We had an independent umpire, Warren Winkler, retired Justice Warren Winkler, come forward and implore the OMA to accept the government's fair offer at that time last fall. The OMA rejected that fair offer. And, Mr. Speaker, we have repeatedly indicated to the OMA that we're prepared to negotiate with them to sit down and have discussions. To date, the OMA has refused to continue those discussions, Mr. Speaker. We implore them to do that.
New question, the Leader of the Third Party.
Thank you, Speaker. My question is for the Premier. Last week, Ed Clark told a business crowd at a $1,000 a plate luncheon that he wants to open our healthcare system to the private sector. When did the Premier give Ed Clark the mandate to open our healthcare system to U.S.-style privatization, Speaker?
Thank you. Premier.
So, Mr. Speaker, I'm going to give the Leader of the Third Party another example of what Ed Clark was talking about, and that is the development of skills and experience here that we have in education and health, that those can be useful to the world. There, on our trip to China, Mr. Speaker, there was a group from a family health team here right in Toronto, Mr. Speaker, and that group was signing agreements in China with medical practitioners there and students there, Mr. Speaker, to share information, to do some training on how we have organized family health teams and some of the practices here, Mr. Speaker. That's the kind of opportunity that we need to continue to look for because, Mr. Speaker, quite frankly, the knowledge and expertise that has been developed here, of course it's good for Ontarians, but it can be good for the world, Mr. Speaker. That's what Ed Clark is talking about.
Speaker, yesterday I asked the Premier about Ed Clark's new plan to link our healthcare system to the private sector. While the Premier chooses to fire nurses, close beds, and is now choosing to open the door to U.S.-style private healthcare, I'm proud to actually defend public healthcare in Ontario, Speaker. Will the Premier make it clear to Ed Clark and make it clear to the 13 million Ontarians who rely on our public health care system that health care should be about families and not
Minister of Economic Development is warned. Thank you. Premier.
Mr. Speaker, I'm honestly not sure whether the Leader of the Third Party actually understands what it is we're talking about, because she's decided on a piece of rhetoric, Mr. Speaker, that actually bears no resemblance to what it is we're talking about. I'm going to give her two more examples, Mr. Speaker. So when we were in China, TVO, TV Ontario, and CBS Consulting Inc. of Markham, Ontario, have entered into an agreement to provide English language high school courses to Chinese students. Right. That's an investment of $250,000, creating 4 jobs. So, Mr. Speaker, here's an example of educational expertise that has been developed here in Ontario that we can now leverage and partner with people in another country to allow them to have access to that expertise, Mr. Speaker. And I will give another example in the supplementary.
Thank you. Final supplementary.
I would prefer the Premier just answer my question in the final supplementary, Speaker. Ontario has been a leader in medical research.
Minister of Education is warned.
Everybody knows that, Speaker. And we have shared that research with the world. I am proud of that, Speaker. Whether it's medication, whether it's surgical techniques, people around the world benefit every day from Ontario's leadership, and we've accomplished this within the framework, Speaker, of our public health care system. We should continue to share our research, Speaker. We should continue to be a centre for innovation, Speaker, when it comes to health care. But I am proud to defend public health care in Ontario, and I sure hope this Liberal government is prepared to do the same. And so I ask, Mr. Speaker, will this Premier do the right thing and tell Ed Clark unequivocally that health care should be public and not private?
Thank you. Premier.